As a concerned nephrology healthcare provider, you know that RPA has been the definitive advocate when it comes to representing the collective voice of nephrology. When it comes to issues that affect all of us, our best line of defense is the RPA PAC.
Most of our representatives in Congress want to do the right thing. And to do the right thing, they need information. And the RPA PAC exists to give them information. So our availability to educate our legislators is critical. So our existence is predicated upon nephrologists who are out practicing every day, understanding that there is an impact of their contribution to the Political Action Committee. As you know, the end-stage renal disease program consumes about 8% of all Medicare dollars. So we have legislators reaching out to us to help them better understand what they need to know with healthcare legislation in the 111th Congress.
In 2008, strong advocacy by RPA and the rest of organized medicine achieved passage of MIPA, the Medicare Improvements for Patients and Providers Act. This resulted in a 1.5% payment increase for physicians that was effective January 1, 2009. RPA PAC continues to engage in a dialogue with lawmakers to encourage them to support RPA's legislative priorities. Are you concerned about any of these issues? The RPA PAC will be advocating for each of these issues during this congressional session.
Look, what's important is for you to let your local legislators know you're available, that you're there for them, that they can pick up the phone and call you because they're going to have questions, so that when legislation comes up that is confusing or isn't clear, where they need some professional insight, that relationship is then extended to us and we can help them better understand the impact of their legislation and help shape the legislation to benefit not only our nephrologists, but our patients. The RPA PAC remains to be active as the only renal-specific PAC to represent your needs and your patients' needs to our legislators. So if indeed you don't have time, and it's completely understandable, money is important. Money allows us to gain the access necessary to educate legislators who will be writing legislation that impacts your ability to be the leader in your patient's care. A contribution to the PAC is probably the best investment in your own future you're ever going to make. If you can't make an investment, invest time. But doing nothing is no longer acceptable in our world. We need to advocate for our patients and for our abilities to remain the leader in their care.
Help RPA effectively advocate for excellence in nephrology practice by supporting the RPA PAC. Now, more than ever, you can make a difference in the future of nephrology.